Hello, welcome to my channel. My name is Bridget. I'm a nurse practitioner and a nurse educator. In today's video, we will be going over 5 NCLEX cardiology questions courtesy of nursing.com. Nursing.com is an excellent resource if you are in nursing school. They have courses, cheat sheets, practice questions, study plans, sim clocks, have videos, and their courses and videos can guide you through nursing school so that you can consolidate studying and focus on what you really need to know. If you want to learn more about nursing.com, check out my affiliate link below. After receiving a terminal diagnosis of congestive heart failure, a client is hostile to family members and hospital staff. The family is upset by this and asks why the client is so hostile. Which of the following responses by the nurse is most appropriate? This is the client's way of coping with the idea of inevitable death. Some of the client's heart failure medications cause sudden mood shifts. A lack of oxygen is causing the client to become hostile. A terminal disease can cause a sudden change in personality. Hostility is a normal reaction to severe loss, so when a client responds to a diagnosis of terminal illness with anger, the nurse should offer the family reassurance. Hostility is usually a temporary stage, and the family should continue to provide emotional support to the client, but also allow space for the client to process this information and ensuing emotions. The nice thing about nursing.com is if you need a refresher, they actually have videos. So if you hate reading, I'm more of a visual and I have ADHD. So videos, for some reason, when I watch something, I tend to remember it more, maybe because it's engaging visual, auditory, like more learning methodologies than just reading something. I tend to remember things better. So video format would have worked really well. And I wish I had something like this when I was in nursing school. Which of the following is an example of a cardiovascular complication associated with immobility? Hyperactive autonomic response, increased risk of thrombus development, decreased oxygenation requirements of the tissues, hypertension. So immobility can lead to orthostatic hypotension, but not hypertension. Immobility rapidly leads to complications associated with many different body systems, including cardiovascular and musculoskeletal complications. Complications include loss of muscle strength and endurance, contractures and degenerative joint disease, an increased resting pulse, decreased cardiac reserve, and venous thromboembolism. The immobile client is at greater risk of thrombus development because lack of movement causes venous stasis and pooling of blood in the extremities. The blood flow may be sluggish and the blood is more prone to clotting. So this is why, for example, if you are flying, and especially for females, if you are on birth control, you're already at increased risk for clots. So if you are flying to Europe, for example, and you're in the States, make sure that you get up and you can wear compression stockings. That helps prevent venous stasis. You can get up throughout the flight, maybe every hour, and do a little bit of a walk. You can, as you're sitting, you can still sit in your chair. You can pedal your feet and flex and extend. So you can do almost like if you were driving a car and you're pushing down the pedal. So you can do foot pedals that way too. A client who has suffered a myocardial infarction requires percutaneous transluminal coronary angioplasty. And they thread that all the way up to the heart, to the coronary arteries, and then they inflate this balloon so to open up that artery, to get rid of the clot and open up the artery. The nurse is preparing the client for the procedure. Which information should be given as part of pre-operative teaching for the client? Describe the procedure, its risks and benefits, and potential alternative treatments. Explain that the client will have a sandbag or closure device placed on the site to provide pressure after the procedure. Tell the client that he will not be awake during the procedure and he won't feel a thing. They are awake, actually. Discuss that the client will have some body hair shaved and he will feel a cold, tingling sensation during the procedure. But I think that during the procedure, they actually feel a hot sensation. So I'm going to go with this. Percutaneous transluminal coronary angioplasty is a non-surgical invasive procedure performed to open an occlusion that has developed in a coronary blood vessel that is blocking blood flow to the heart. The procedure is performed by inserting a catheter into the femoral artery and threading it up to the affected site. A balloon is then inflated in the affected area, which opens up the vessel to allow for blood flow. Because the catheter is introduced in the femoral artery, there is potential for significant blood loss following the procedure when it is removed. A sandbag or closure device is placed on the site of entry to provide direct pressure and allow the blood clot to prevent bleeding. we didn't have sandbags at our hospital, and we would just have to, well, maybe during so when they would bring them up to our unit, they needed to lay flat for 4 hours, and we did not have sandbags, but maybe they applied the sandbag already in the operating room. I had a situation where one of my colleagues, unfortunately, her patient didn't want to lay flat for 4 hours, and he pushed the button to make his head go up, and blood just started squirting everywhere. And this poor nurse, like, she came out of his room, like, she had tried to stop the bleeding, and she came out and she was just like covered in blood. It looked like a scary movie. She was just like drenched in blood. A 70-year-old client comes into the emergency room complaining of dizziness and lightheadedness. They state that their most recent 2 stools were black. What is the nurse's priority assessment? All right, so we're concerned for a GI bleed, and if they're losing a lot of blood, then priority assessment, let's do vital signs. Priority assessment would be vital signs, because what is this patient's blood pressure? How bad is their GI bleed? This client most likely has an upper GI bleed. The client in this situation can lose a lot of blood, which requires rapid assessment and management on part of the healthcare staff. The nurse's first response would be to monitor for changes in heart rate and blood pressure, because blood loss can lead to hypotension and tachycardia. Following this step, the nurse may need to give the client IV fluid and assist the provider with further diagnostic tests and treatments to manage the bleeding. A nurse is caring for a client in a cardiac telemetry unit and notes the above image on the client's EKG strip. Which electrolyte value would the nurse be concerned about? Biphasic T wave, prominent U wave, depressed ST segment. With sodium sodium abnormalities will not cause T wave inversions on an EKG. And abnormalities in calcium tend to cause rate and contractility issues. And so potassium can cause a lot of changes, like hyperkalemia, even hypokalemia can cause a lot of EKG changes. So that's why that was the best answer. Thank you so much for watching. Make sure that you hit that like button and you smash that subscribe button. I currently have a goal of hitting 30,000 subscribers. I've been at this for 3 years and still haven't reached it. So it would mean a lot if you subscribed, and keep in mind that it doesn't cost you anything to subscribe, and you can always unsubscribe later. Until next time.